Great. Okay, well, I'm going to talk about some of my experiences in trying to overcome the challenges in the deployment of OR projects in the public sector. And I'm going to start with my learning points from my early career in government OR and British Coal, and then talk about community operational research when I moved to Sheffield Business School, and also how I'm trying to learn from those experiences when using the public sector scorecard. So in my first two projects in government operational research, I was very lucky to work with some experienced colleagues who really thought about the deployment issues. So this project was a cost-benefit analysis, snow clearance, number of snow ploughs you needed in different parts of the country on motorways, had a simulation model for different snowfall scenarios, snow clearance policies, etc. But what they did was they had monthly meetings with a steering group, and that steering group included government scientists, the national director, but also a former snowplough operator as well. And that meant that the staff agreed our assumptions as we went along and felt committed to them. And I felt that, if we just had our final meeting at the end, we had just got one or two of the scientists querying our assumptions, and our report would just sit in some file somewhere in the civil service for several years. So my learning point from that was to ensure regular contact, not just with the client, but with a range of relevant stakeholders and experts. Then when I did work at the Department of Health, I was working with Professor Ray Jackson, who later set up the Clinical Operational Research Unit. And we were comparing treatments for a particular type of leukemia using a mathematical sort of queuing type model rather than the normal standardized clinical trials. And there was close client and staff involvement throughout. I didn't myself, but my colleagues did go into the operations with the clinicians. And there was a lot of client involvement. And what it meant was that they did make a big breakthrough in that treatment, probably a year or two earlier than if they'd had the random statistical trial. So my learning point from that was involve the frontline staff, the people who are actually doing the work, and they weren't just the doctors, but all the people who would be in the operating theatre, and that's my second learning point. Then moving to British Coal, it was a long time ago, and the project was on presenting the financial case for industry to convert from oil to coal. At the time, the EU and the British government were giving financial incentives to industry to convert to coal. And but when we developed what we thought was a good model, we found the marketing department was very old-fashioned and a bit not really receptive to new ideas. But it wasn't until we managed to talk to some of the junior staff, get them to use our software, we did training courses around the region, that it became successful software used in every marketing region. I gave a presentation to the people in the picture, the British Coal chairman and the Secretary of State for Energy. That's a rather younger version of myself. And also filmed on BBC TV with the OR group. But that wouldn't have happened if it had just been left to the senior management. Get close involvement with staff at all levels, and particularly perhaps find those you think are more receptive to the sorts of change you're looking for, and get more closely involved with them. Then when I moved to Sheffield Business School, we were successful in our joint bid with Northern College to host a new national community operational research unit that the OR Society was funding. And I didn't have a major role there, but I did do one project there. But it gave me the opportunity to learn from several experts in problem structuring and in community operational research. And two main learning points from listening to them was that involving, empowering and listening to service users was important in itself, but also led to more successful deployment. And also that problem structuring methods and soft OR were crucial in this process. I was obviously aware of them, but working in British Coal, didn't really know anybody actually used them in practice. So that was a good learning point for me, that the workshop type approach was a successful one. Then when I, probably about the year 2000, 2001, developing the public sector scorecard, I had two aims. One was I wanted myself to get involved in some of the bigger issues affecting Sheffield and the UK. And I also wanted to help OR improve its deployment. So I used the workshop-based approach from community OR involving staff, service users, other key stakeholders. And the second thing that I noticed was a lot of good projects in OR that on the processes and met certain strategic objectives. But the strategy, that was what one person in the client thought was a good idea, but other people in the organization didn't necessarily agree with that, or they might feel they'd like to be a bit more involved or should have been consulted. And so the projects didn't happen for that reason. Also, sometimes people come up with a good project, good recommendation, but it only really works if you do other things as well. You get better partnership working, talk to people better training for your staff, whatever it is, you need often to do more than that process to do that. So if we can get involved with strategy and service improvement together, we're going to get more deployment. And performance measurement too, you don't want your work to be monitored on performance measures that are arbitrary and don't focus on the unit, on your strategy. The next thing I observed the balanced scorecard in the private sector trying to get involved in strategy, service improvement, performance measurement, but that was very much private sector model focusing on financial results. So I tried to translate that to the public sector, who are concerned about outcomes, the outcomes that matter to people, the processes that produce those outcomes, and then capability, which is how you as an organization can support your staff in their processes. Also, I don't know any project in the public sector that doesn't require work across organizational boundaries, whether it's health and social care or whatever it is, you need to do that. And finally, particularly for performance measurement, we need a culture of improvement, innovation and learning, and not a top-down blame culture. And so the three phases in the public sector scorecard, it's a strategy mapping the strategy of the organization, service improvement and performance measurement. And this shows some of the outcomes, the service user stakeholder outcomes, but the main outcome is the strategic outcomes for the organization, what they want to achieve. And then there's a financial outcomes like value for money, breaking even, and sustainability, both for the organization and also maybe for the planet as well. Then we have the service delivery. You can see how OR can fit into this. There's quite a lot of OR people looking at strategy and a lot looking at service delivery, perhaps using simulation, systems approaches, etc. That goes into that to see how we can deliver the outcomes. But then that's not all. We need to think about, people. How do we support our people, motivate them, give them the proper training, partnership working, who do we need to talk to, and make sure we get adequate resources. Again, we need a culture of innovation and learning and not a blame culture. And we need proper leadership that focuses on the outcomes required. So this is an example for the Sheffield's Stop Smoking service. The aim was to improve the service. It was the only thing in Sheffield actually that didn't get 3 stars at the time. There's maximum 3 stars in the rating system. So we managed to get a bit of support for that. And basically the service was a combination of group counselling plus medication like nicotine patches, and there was evidence that doing the two together was far more successful than either one by itself. So we started with 3 service user workshops. So over 100 people who'd been to these sessions in the past came and gave their feedback. And then we had a number of workshops with a reference group that had a few service users, senior managers, as well as the director, doctors and other stakeholders. And with them developed the strategy map. And this is just an excerpt from it. The main outcomes were more people stopping smoking, but also equity of access and user satisfaction. The processes, the main thing we did was getting more sessions in and in better locations, particularly for some of the poorer people who weren't accessing them in the past. And as an example of how it works, I'm sorry, just one of the things that the users in the workshop said was they made this momentous decision to stop smoking, and then they go to their doctor, their general practitioner, to get their prescription, and it took 2 weeks, up to 2 weeks for them to get it. And so the brainstorming workshop session came up with, you know, one method, which was a voucher system, so they could go straight to the pharmacy. Another thing they wanted was better phone support. We only probably had 1 or 2 staff, but they couldn't afford more staff in the service, so they made use of other helplines, national and local helplines, so that if somebody rang when the phone was engaged, people could enroll them on the different sessions. So that was how it worked through the workshop type situation. Obviously, we also had performance measures based on each element of that strategy map. And the results, we had a number of people stopping smoking doubled during the project and has stayed at that level ever since, and some good feedback there from the director of public health at the time. And the learning point for me was, you know, I was really just trying it out, and but I did find that involving the service users and stakeholders really did work. And the final project I'll talk about was a project on child obesity. I managed to secure a small amount of government funding to work with Sheffield's obesity team. And at that time, we had the opportunity to bid for a £10 million programme of government funding. And based on some of the strategy maps we developed, we thought we'd use a systems approach, tackling obesity in several ways at once. And we then developed strategy maps for each of 8 strands and for the programme as a whole. And we had workshops with programme board. I was a member of the programme board and leading the evaluation as well. And we did workshops with each of the strand teams, the voluntary sector, parents, and Sheffield Youth Council. And we used a combination of the public sector scorecard and the theory of planned behaviour. So these were the 8 strands. There's some social marketing. We called ourselves Sheffield Let's Change for Life. And you can see we're doing a number of things at once, improving diet, getting people more active, etc. So when we came to develop the strategy map, main objective, reducing obesity through better diet, physical activity, etc. But we also wanted value for money, sustainability, so that, you know, we got 3-year funding, but we wanted things to be able to last after that period as well, and satisfied stakeholders. So this is the strategy map for the programme as a whole. And these were the 8 strands of the programme. And then I was trying to think, when I looked, I wasn't very happy with this because, you know, even though we had, you know, director level staff involved, they couldn't actually make people change their behaviour. And I wasn't sure, how would we know what we did in these processes actually achieve the outcomes? And so I shared this with my team, and in the evaluation team, we had the School of Sport and Exercise Science with experts in child obesity, and they said they often used the theory of planned behaviour. And so we integrated that with the public sector scorecard. So we wanted the programme as a whole and each strand to try to get people to have a greater desire to adopt a healthy lifestyle, favourable attitudes of others. If I make a change, will my friend or my partner think it's a good idea? Confidence, do I know how to do it? And also overcoming barriers to change. And we also use those as a driver to thinking about, well, what do we want to do in each of these strands? And we also need to look at the capability. These things weren't going to work without a shared vision or joint working between Sheffield City Council and the NHS, third sectors. We need community engagement, project management, and effective leadership from the programme board. And again, some good feedback, help people understand the outcome and process measures the programme was trying to achieve and therefore being evaluated. So my learning point from my colleagues there was to address behavioural aspects as well. So I want to now just come back to our initial thing about deployment, and I think it all starts from, what do you think makes a good OR project? Is it identifying the best solution to a problem, having really good recommendations, writing a good report, or an impressive presentation? And my view is it's actually all those, but if you really want implementation, you need to think of it in a different way. You need to think of it as your overall role is to assist the client in implementing successful change. From the client's point of view, change is difficult. They've got to get their own fellow directors or fellow level of staff. Then they've got the workers, the employees might think, they're going to be affected in an adverse way. And my experience is, if you involve these people right from the start in what you're doing, then you're going to get more implementation. So think about all those other aspects, but also think about, that's what you're trying to do, is implement successful change. And then just finally, a sort of strategy map, if you like. If you want to increase the deployment of OR projects and contribute to the major problems facing society, have a systems approach, involve your staff, service users, other stakeholders, work across organisational boundaries, use soft and hard OR methods, address strategy, service improvement, performance measurement, outcomes processing capability, address the behavioural aspects, think about risk, and making sure you don't have that top-down blame culture, but a culture that people want to improve and want to innovate. And if you want to, use a public sector scorecard. Thank you very much.